Okay, so today I'll be covering the topic of breast or ovarian cancer, more specifically breast cancer, but I know it's sometimes grouped between the two names. But the main reason I wanted to look into this disorder is because it's actually affected a few people I'm close to within my family and within my family friends or other friends' families themselves. So it is something that's pretty close to me and that I really wanted to kind of learn more about. On the left here is my grandma Joan and her lovely husband Artie. They are my grandparents on my mom's side. My grandma Joan actually had breast cancer at one point in her life and luckily survived it. Here she is now, almost 90 years old actually, and looks phenomenal. And then on the right is my mom's best friend from college, Ronnie. Ronnie also had and survived breast cancer. So these are two people that are extremely close to myself and my family that have been affected by breast cancer. Here's a quick overview of the disorder. It's mainly caused by mutations in the BRCA1 or 2 genes that occur on chromosome 17 or 13, respectively. If you direct your attention to this chart on the right, you can see that roughly 48% of cases are between BRCA1 and 2. It's actually a feature of several kind of cancer syndromes, which are mainly due to, or some are due to germline mutations, but other cancer syndromes include ovarian cancer, like I mentioned before, and sometimes prostate. But essentially what happens with this disorder is that breast cells become abnormal and they start to multiply and eventually form a malignant tumor. So then eventually the tumor, well, I'll get into treatments later on, but the tumor will almost indefinitely have to be removed at some point. Around 5 to 10% of these cases are hereditary, and it's arguably one of the most commonly talked about or commonly known types of cancer because it's so common. And in this sense, 1 in 8 women will develop this disorder in the developed world. So this constitutes first world countries mainly. Continue on the overview. Like I said before, BRCA1 and 2 are the most commonly mutated. With new technology and new testing capabilities, they're actually discovering more hereditary associations. So like I said before, about 5 to 10% of cases are identified with a very strong inherited component. But however, there are sometimes between 10 to 30% of these cases attributed to hereditary factors without a very strong correlation, but it is something to note. And the technology can actually lead to parallel testing of multiple genes. So they're identifying more and more genes that can contribute to contracting this disorder. Some of the risk factors associated are hormonal and reproductive histories or negative histories, age, alcohol, radiation, lack of exercise, and fatness in at a young age. So essentially, things that everyone would want to stay away from can actually contribute to contracting it. And seen as in this diagram on the right, decreasing the risk can be caused or be achieved with physical activity and essentially just staying active at a young age. And then there is very convincing evidence that alcohol, fatness, and weight gain is increased or increases the risk of developing breast cancer. Like I said before, it is the most common form of cancer and actually the second most common cause of death from a neoplastic disease in women. So there's some controversy over if it's genetically inherited. A study from OMIM suggests that sisters of women with breast cancer whose mothers also have it or had it at some point are about 47 to 51 times more likely to actually contract this disorder. So therefore, we can conclude that the risk to affect people whose families are affected is much higher. Also, affecting women in general is much higher. And in this diagram on the right from 23andMe, which is a DTC genetic testing company, it says that 90 to 95% are non-inheritable, which, as we saw before, is not really the case. They say that only 5 to 10% are genetically inherited, which is just not true. So the evidence does suggest that genetics do play a role in developing breast cancer. And I've included a pedigree chart to the bottom right as well. So in terms of the classification, there there is kind of very strict eligibility for hereditary testing. Patients must meet very strict criteria that complies with the ASCO policy, which is just a research and patient care advocacy policy. And in a study in NCBI, which we'll head to right now, it actually classifies some of these cancer disorders in certain risk factors. So anything that's considered a high penetrant gene has a risk over 5. Let's go back. And then in terms of the treatment and testing, the susceptibility can kind of cause clinical management and identify familiar risks, offer treatment guidance, identify other at-risk members in the family, and from there they can offer customized gene-specific treatment options. So having this knowledge and this advanced technology is so vital in the future of breast cancer treatment, in the future of identifying and studying the disease. And it's very important to me simply because of how much it's affected people close to me and the fact that it's becoming much more tested and technologically capable is incredible in my opinion.